The Massachusetts Department of Public Health is looking to open safe monitoring sites where people who use illicit drugs can be watched by a medical professional after taking the substance. Proponents say this is part of an overall strategy of harm reduction. Carolee McGrath sat down with two Mercy Medical Center employees, Dr. Robert Roose, the Chief Medical Officer, and Dr. Ari Kriegsman, the Medical Director of Addiction Consult Service, to learn more about what this would look like.
Right now, the state is engaged in a process to move forward an idea that has to do with harm reduction that really is focused on saving people's lives that are struggling with opiate addiction. If I could go back just a second, we're still very much amidst an opiate crisis, and here in Springfield and the surrounding counties is an area that is particularly troubled and challenged still by high rates of overdose deaths. And so the state has looked at what some new novel and innovative ideas might be to help prevent people from dying from opiate overdose. And safe monitoring centers or medical observation post-overdose is one of those ways. They're specifically oriented around ensuring that people don't die from an overdose, that they get education and engagement, and then get connected to treatment afterwards.
How would it be set up? Like, who would be in these different clinics?
Yeah, so right now the state is undergoing a process to look for interested community agencies, hospitals, or providers to develop these in probably about 5 areas throughout the Commonwealth that are particularly hard hit with opiate overdose. The way that they're set up is really modeled off a very innovative and successful and effective program out in Boston that's housed in the Healthcare for the Homeless location that has been called SPOT. Dr. Jesse Gaeta, the chief medical officer there, has developed a wonderful program that has some remarkable outcomes considering the population that this is reaching. And the way that it's set up is that there's an area where individuals who may be under the influence from a substance are able to go in safely, be monitored by registered nurses or nurse practitioners, receive any kind of treatment or support that they might need, and then be engaged by peers, oftentimes recovery coaches or other community health type workers, all under the supervision of a physician or somebody with a medical license and addiction expertise that can help ensure that patients are taken care of appropriately.
So this is sort of a first contact maybe for many people. So they would go in there, obviously, you're taking care of their immediate needs, but then there would be that after contact of saying, hey, we have counseling services, we have recovery coaches. Is this effective?
Yeah, what we know from the SPOT at least is they were able to engage about 20 or 25% of the people that they were seeing were able actually to get engaged into addiction care afterwards. And so having a place, I think, where people feel comfortable and people feel safe and actually build that rapport, I think is a really valuable resource because people know then where to go when they're ready for help. And I think just having that place and a touch point where they can both be safe, but also really has shown that there's evidence that it can be really a good starting point to get into treatment.
Some people might be a little bit cynical about it because there was a lot of controversy when we were talking about, I think about a year ago, safe injection sites. Mm-hmm. Some people might say, hey, listen, this is just a step down, right? Somebody gets high outside of the clinic and then walks into the monitoring site. Does this encourage behavior, as some might, say?
Yeah. I think probably the best evidence we actually know is from probably the safe injection sites, supervised injection sites, where they've done some pretty rigorous research on it and actually shown that it doesn't actually encourage ongoing use or initiation of use, and actually encourages people, because of the access to treatment that can start there, it actually encourages people to begin the process of recovery. So it seems like there's from the research that's been done so far, it's pretty robust to show that it doesn't encourage new use, and probably there's actually a trend towards people getting into treatment and reducing their use.
Is that one of the challenges that you both face, I assume, is really challenging, I guess, the opinions that people have always had about substance abuse, and perhaps they would come at it, from a different point of view, where you're saying, listen, this will be our initial contact to get this person into recovery. Is that a challenge for you as you try to help people?
Yeah, I think, the culture, I think, is changing around this. I think public opinion is changing around, and I think the crisis is such that it's hard to meet anyone these days who hasn't had a family member or a friend or a colleague affected by it. And so I find that there's still a long way to go in terms of culture change and some of the stigma that people have. But I think the more people who are unfortunately affected by this, I find that the conversation is opening up more and more to help you. Like, if this was your family member or your friend, where would you want them to be? Would you rather they were in a public restroom? Would you rather they were like in a park and nobody else was around? Or would you rather them be supervised somewhere? So I find that the conversation still has a long way to go, but I think there's some big steps forward.
And when you talk a little bit about the opioid-related deaths statewide, they're trending down. But you talked about Western Mass being particularly hit hard in this area. Tell us a little bit about what's happening in Springfield and Holyoke.
Yeah, so that's right. So statewide, I think largely related to a lot of the work that came out of the working group, really setting a framework for how do we prevent and intervene with patients. We've seen a decrease in overall overdose fatalities across the state. That has not been the experience right here in the city of Springfield and some other of the surrounding towns like Holyoke. In Springfield, actually, there was an increase in the overdose death rates between 2017 and 2018, and in Holyoke, they've stayed about the same. Why that is, I think, is for potentially a couple of different factors. One is we are in an area here that is very sort of rife with potent fentanyl synthetic analogs that are highly potent, that can create an overdose death in just a matter of seconds. And in communities where fentanyl rates are so high, that certainly presents an additional challenge in order to try to make sure that we can prevent death. Secondly, we're in communities where we need to ensure that all the interventions that we've developed are reaching those populations. And what we've seen from some of the evidence is that communities of color, Hispanic and Black communities, have actually suffered dramatic increases in overdose death rates when those in white communities have actually decreased. So that speaks to, I think, to ensure that the interventions that we're deploying are able to reach all of the population throughout the community, and to recognize that there may be some very additionally marginalized or special communities that we need to do some new and innovative things. And when we look at harm reduction, I think that's where we can see, like the safe monitoring centers, some new ways to reach people that maybe otherwise hadn't been reached, and that we can look to prevent death in all communities, including right here.
And harm reduction, of course, would include, right, Narcan. I know that was pretty controversial when that was starting to be implemented a few years ago as well. Yes.
And harm reduction is a strategy. It's really a philosophy, right, to reduce harm from a behavior that can create problems. It's one that honors the dignity of people, honors the autonomy of people, and can be defined by a set of strategies that look to reduce the consequences, in this case particularly from substance use. So that can include the use of naloxone, that can include the safe monitoring centers, it can include low threshold engagement with individuals that are using substances. It's really all about meeting people where they're at, providing services that attend to and reduce those risks, and helping them lead healthier lives.